Namaste and welcome to Citti Media. My name is Divyanshi Sharda, your host. Today we have a very special guest joining us on our show, Urvashi Prasad ji. Shri Urvashi Prasad ji is a public policy specialist in the office of the Vice Chairman at Niti Aayog. She is involved in the work of Government of India's Empowered Group 1 for managing the COVID-19 pandemic in the country. Urvashi ji is a member of the task force for overseeing the implementation of sustainable development goals in India and co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in 2017. She is a member of the World Economic Forum's expert network and an alumnus of the World Economic Forum's Global Shaper community. Urvashi ji, namaste and welcome to our show.
Namaste. Thank you for having me here.
It's a pleasure to have you on our show, Urvashi ji. So, coming to my first question, ma'am, regarding the COVID-19 pandemic, and since you are on the core team of the same, of the management committee of the same, it's really important that we address some very key concerns that are on the minds of the Indian public in the 21st century in our country today. So, ma'am, concerning the March-April spike of COVID cases that has occurred, could you kindly elucidate in detail as to why it happened and what the modus operandi of the government to control the rapid transmission of the virus has been?
Yes, so there's a couple of major factors here why we have seen this second surge. But I think before I get into that, just for the benefit of everyone to understand that pandemics by their very nature are very unpredictable. And that is why they cause so much devastation, unfortunately. Whether we look at the Spanish flu, which happened, about a century ago, or various other, epidemics and similar such outbreaks that happen in different countries, they are very unpredictable. They're very dynamic. The situation changes very quickly sometimes. And in this case, what has made it more difficult for everybody is that it's a completely new virus. It's a virus that we have not seen before. It's a virus that we don't understand. Every day we are learning something new about this virus. Scientists globally are hard at work. Everybody is trying to understand the virus better, understand its genetic behavior, etc. But it's very important to state this at the outset that it's a very unpredictable beast that we are dealing with. So I think that is, something that has to be put out. That, pandemics are very difficult, therefore, for even the best of health systems or countries which are very advanced, very developed also, can get very overwhelmed by a pandemic. So I think that was just context. Now, coming to why this surge has happened in the country, the second surge, as we are calling it, there are two factors. One is that, over the course of several months last year, we had become quite careful, about our behaviors in public places. We were wearing masks. Many of us, at least in the cities, in the urban centers where the first wave was much more prevalent, we had started getting more used to wearing masks, hand washing, maintaining distance. For a long time last year, we were under lockdown. So, people were just working from home. People were not getting out of their homes. So I think last year we did a fairly good job as people, as all of us, in acquiring these behaviors. Because again, it's important to say that these behaviors are very new for us. In India, we are not very used to wearing masks. So, these are fairly new things for the population. So actually, last year we picked it up quite quickly compared to what I might have even expected as somebody who's worked in public health for all these years. But what happened is that somewhere that behavior started slipping. Towards the end of last year, we became a little more relaxed. There were many more gatherings, there were festivals, there was the wedding season. So whether it's gatherings for social reasons, political reasons, religious reasons, whatever those reasons might be, we started doing many more of those gatherings. We started going out of our houses a lot more. We also started going out for work a lot more. The economy also started picking up. So a lot of people who were actually sitting at home for several months last year, towards the last part of the year, they started actually going out as well. So I think collectively what happened that somewhere, because, in public health, the very first word is public. So public behavior, dictates to a large extent the course of such an outbreak, the course of such a pandemic. And I think all of us somewhere, it's a collective, responsibility, I would say. I'm not blaming anyone because, as I said, they're not very used to as people, wearing masks or doing these things, but it became a collective issue in this case. The other factor is that the virus has also changed a little bit. It is true that certain variations in the virus have come, certain mutant strains came into the country also from outside. And then further, we saw certain mutations within the country itself. So I think both those factors combined eventually led us to this surge, and very, very high numbers that we are seeing today, unfortunately. And I think when you have such high numbers, even if you have the best health system in the world, you can feel very overwhelmed. So I think that is not surprising that the health system in many places has got overwhelmed. But various steps, are being taken, have been taken, and are being taken, and are also being accelerated. Whether it is to increase testing in the country, whether it's to improve the oxygen supply, not just right now, but also in the future, because we might even have a third wave, we might even have a fourth wave. That is how pandemics are. So we have to be prepared not just for the immediate situation, but also for the future. Vaccination, a lot of work is going on, and we'll talk more about the vaccination, I'm sure. But how to boost supply, and also very importantly to get information to people, because in a pandemic there's a lot of panic, it's a crisis situation. So sometimes people are not aware, what do we do, how do we manage it, when do we stay at home, when do we go to hospital. So the efforts are also on to get that information out to people, the verified accurate information, so that there are no myths or misconceptions. Sometimes otherwise what happens that if somebody's saturation level for oxygen is even 92 to 94, even then they start thinking that I need to take oxygen, which is not true. In fact, it could damage their lungs, because 92 to 94 saturation is perfectly all right. So simple things like this, government is of course trying, but we also have to use the networks of civil society, we have to use the networks of private sector, of citizen groups, to get these messages out to people, so that apart from whatever the health system is doing, the panic amongst people is also reduced, and people also know what are the correct decisions to take at what point in time. So I think on all these fronts, efforts are on right now, to not only manage this present situation, but also make sure that we are prepared and better prepared for the future.
Thank you so much, ma'am, for that. And the next question that is on the minds of many is that why did we specifically wait till the indigenous vaccines were released to start the vaccination process? Shouldn't we have started the inoculation by importing the vaccines from December itself?
Yes, so I think on vaccines, one thing is very important to understand, that normally it can take years and years to develop a vaccine. In fact, there are many diseases, common diseases like adult tuberculosis, like dengue, like malaria. Till today, we don't have a proper vaccine for these, despite years of research. So what we have managed to do with COVID is in fact very, very fast tracked, is very accelerated. And I'm not saying we as in just India, but I'm saying as a global scientific community, what we have managed to pull off with the COVID vaccine is actually in very quick time. And that is because we put our collective, might and investment and resources behind it. And that is perhaps why we managed to come up with these vaccines very quickly. Now, for India, there were many considerations. One is, of course, that you need to make sure that there is a strong, scientific evidence base. In fact, when we gave approval to Covaxin, our indigenous vaccine, a lot of people questioned that maybe you have given premature approval. So actually, a lot of people questioned us that have you given approval too early, right? So I think, therefore, in a crisis, it's a very fine balance for any government, for any drug regulator. You want to get the vaccine out quickly because you know it will save lives, but you also want to make sure that you have enough data, and enough data in your setting. So, XYZ vaccine might work well abroad, but it might not work in the Indian context. So we do need evidence which is India specific. And I think that is what, which people actually see as a delay, but perhaps it was just the scientific process taking its course. And I think for Pfizer, for instance, people must remember that it requires storage at minus 70 degrees. Now, very few places in a country like India, you can actually store a vaccine at minus 70 degrees. So it's not very suitable for scaling up. And this is not just specific to Pfizer. This is true for various vaccines, which might require very sophisticated, storage facilities, or which might require certain systems, which you can pull off maybe in a highly developed, small European country, but you might not be able to pull off in India. So what I'm trying to say is that apart from the scientific considerations, regulators, government in a country like India also need to think about the applicability of the vaccine to the Indian context. Can we store it here? Can we distribute it here? Can we scale it up here? All these questions also come before us. So I think that is what I would say to that. Yes, now when we look back in hindsight, I think it's very natural for people to ask this question, that could we have started vaccination earlier? But I just want to put out those caveats and those constraints, both on the scientific side as well as trying to implement such a large vaccination program in a very diverse country like India, where your temperature conditions are so variable, you don't have those kind of sophisticated storage facilities everywhere. It is genuinely very, very challenging. So I think that is why the kind of vaccines which were available in December, which were very, few ones like, Pfizer and, later Moderna, etc., became available. Therefore, there was some hesitation to immediately bring these in. And also, I think those vaccines, the companies themselves were not very sure that they can immediately come to India. So even the discussions with them were such that they said, okay, maybe we can come by June this year or July this year, but it was not clear that they can actually immediately also come in December. So I think there were various factors at play, as to why we didn't immediately import the vaccines at that stage. Today, of course, we are in a very different position. And so now the government has actually given approval, emergency authorization to vaccines which have been approved in the US or in Europe or in Japan. But that is because today we are, in a situation where we have this massive surge. We have to attack it on a war footing. So now the decisions are obviously a little different. But in December, the context was also a little different. A view that the health minister has also publicly expressed, that there was a lot of states which were saying that we want more flexibility, when it comes to vaccines. We want to have a greater say in the procurement, and who do we give it to, who should be prioritized, etc., etc. So I think that is where you have seen this new vaccine approach, where 50% of the doses the center will still procure and provide to the state. So that 50% is not going to go away anywhere. The remaining 50% is where the states have been given flexibility, that you can actually negotiate with the manufacturers directly. You can come up with your own, pricing arrangements. And we've also brought in the private sector, because I think it's very clear that in a country like India, when you're trying to immunize so many people so quickly, we need all the powers to come together. So we also had to involve the private sector, right? So, that is where that additional flexibility was also built in. But that is for that remaining 50%. I think the 50% that the center will continue to provide to states, that stays. That is not going away anywhere. It is the other half where the flexibility has been given to states. So as I said, you can argue this both ways. You can say that why have you given that, flexibility to states? The center should have continued to control everything. But there's another argument which says that, in a federal structure like India, the center cannot control everything and has to also bring in states in a bigger way. So I think these are the complexities of handling a pandemic in a federal structure. I think that is something that I think I want to put out. Because, often we say that Vietnam has done such a good job, Thailand has done such a good job. Let's not forget that they are almost unitary forms of government. They don't deal with the complexities of a federal structure. They are, of course, much smaller populations, but leaving that aside, they are almost centrally controlled. And I think in India, we over several months, we saw many more calls from people that you should decentralize, you should give more power to states. And I think, as I said, we can argue both ways. There can be pros and cons. And in hindsight, especially when we look at it, we can always say that, no, maybe the center should have controlled, maybe you shouldn't have put it on states, etc. But these are all up for debate. I think why the center did it, the center's position has been officially stated, that it is because there was an ask for flexibility in all aspects, including vaccination. But it is not to be mistaken that the center will not play a role now in vaccination. It will continue to play a role. It will continue to provide its 50% of doses to states. It will continue to provide free vaccination in its own facilities to people above 45 years of age. Center will continue to play a very big role in boosting manufacturing supply across the country, whether it is increasing the capacity of our two existing manufacturers, Bharat Biotech and the Serum Institute, whether it is bringing in Sputnik. In fact, just today, the Sputnik rollout has started in the country. Whether it is bringing in additional vaccines, whether it is investing further in research and development. We are actually hoping that by the end of the year, we should have not just 3 vaccines, but we should have 6 or 7 vaccines, which are available to people. And when that happens, you can imagine that the pricing will also come down a lot. You know, if 6, 7 vaccines are out in the market, people have a lot more choice. The prices will come down further. So it's not to be said that the center is withdrawing at all from this vaccination process or from anything. It is continuing and will continue to play a big role in various facets of the vaccine program. But yes, the sharing of the doses, the split between center and states, the giving the flexibility to states, I understand. You know, these are questions which can be argued both ways. And as I said, I'm not here to defend or attack anybody. But I am just putting forward, a sort of a perspective from both points of view. And also as a public health, professional who's trying to think about how do you manage this pandemic in the federal structure. A lot of these are questions that I also grapple with. But I think that is what we need to understand. And I think the pricing, of course, that is why the government is also pushing that we need to bring down the pricing as much as possible. Because as I said, we are in a public health emergency. The biggest goal of the government right now is to vaccinate as many people as quickly as possible. So everything we can do for that, whether it's bringing in new vaccines, boosting existing supply, boosting research and development to, create maybe easier to give vaccines like the nasal spray. If we get a nasal spray for COVID, in the latter part of the year, that could be a game changer. So government is continuing to also invest in those research and development efforts. And we don't know in a few months from now, if you have a nasal spray, for instance, then you don't need a needle, you don't need a syringe. It can be given very quickly to people, very cheaply to people. It can also perhaps help to cut down transmission of the virus from one to the other, as opposed to just preventing severe disease in an individual. So I would say that, let's be optimistic about this. Let's be hopeful that even in 2-3 months from now, on vaccination, we should see a much better picture. And I think the center and states have to work together on this, and have to make it work together along with the private sector, because we can't leave our private sector out of such a big effort. We are trying to implement one of the largest vaccination programs in the world, so we have to bring every possible stakeholder into it. So yeah, I mean, I realize I've given a little more context than your question asked for, but I just wanted to put everything out there so that people have a more comprehensive understanding.
Yes, thank you so much for that, ma'am. So if I were to put it in perspective, can we say that the reason center is asking for the reduction of prices, or the reason there is a discrepancy in prices between state and center, is because the center already has to provide 50% of the vaccines to states free of cost, and that is why it's asking for a lower price for itself and a higher price for the states?
Yeah, I mean, the states are free to negotiate, is basically the point, for their 50%. They can also negotiate a lower price, a different price. It's just the flexibility which is there for the remaining 50%. So I think the principle here is of flexibility and decentralization for the remaining 50% doses. But the 50% the center will anyway continue to provide. That does not change. The only flexibility angle, whether it comes to pricing, whether it comes to guidelines, if a state decides that for us, a priority of certain types of groups, has to be there for vaccination, they can do that. They don't have to now go just by the central guideline. So I think the flexibility has come in procurement, in guidelines, and that is the principle of why the center has done it. We can of course, as I said, argue both ways. There's a lot of difference of opinion and there's a lot of different views, but that is the principle behind why it was done.
All right, ma'am. Now that the vaccine pricing for the state and center has been well decided, uh, do you think that it is right to open the vaccination for 18 plus people without completely checking for side effects in the long run?
Yeah, so again, this comes back to the answer I was giving initially, that normally a scientific process of vaccine development, drug development could take several years normally, right? But we are not in a normal situation, and so that is the trade-off that we are having to make between making sure that we have enough credibility, because of course, I don't think there is any regulator in the world which wants to put out a vaccine or a drug for its population without having enough credible data. So I think that is something that nobody would want to do. And certainly in India, we are not wanting to do that either. But the factor we have to balance it against is speed, because if we say that I will keep waiting for data for 1 year, for 2 years, then I cannot even provide the vaccine to people, and I might end up losing many more precious lives, in the meantime. So these are trade-offs. I mean, as I said, I come from a scientific background. So for me, I myself would keep questioning a vaccine or a drug, that do we have enough data? Because that's how I am trained to think. Do we have enough data on efficacy, on safety? But we have to realize that in a pandemic, it gets balanced out with the speed at which you need to get it to people. And right now, the fact that we are in the middle of this surge where we are also seeing young people getting affected, it's not just older people, but there are also younger people who are getting affected. It was important to open up the vaccination process. On side effects, I would say that now we have fairly good data, actually, beyond the data that we had just from the trials. Now that the vaccines have been administered to millions of people in our own country, and we are actually tracking, a lot of those side effects, etc. By and large, those are very mild side effects so far, thankfully. There are certain people who have had more serious reactions, or there have been certain fatalities, but we are looking at the evidence, that is it actually linked to the vaccine, or is it linked to something else, because the person might have had some underlying condition, might have had some other issue, but those are very few. Those are very, very few. For the vast majority, the vaccines are well tolerated. You don't have any severe side effects. So I would say to people that right now, if you are eligible for a vaccine, don't be hesitant. Don't be hesitant. Go out, get it. Don't worry whether it's Covaxin or Covishield or Sputnik, or don't worry about that, because all these vaccines have gone through as rigorous as possible in this time frame, an evaluation of both safety as well as efficacy. But also, people should remember that this is a live process. We will not stop tracking. We will continue to track. As the vaccines are given to more people, we will continue to track. And if something very serious or alarming comes up, we will take action. As I said, no regulator, no government will keep giving a vaccine or a drug when you have sufficient evidence that it's actually going to harm people. More than do good. So that will not happen. But as of now, whatever evidence we have is very good. The safety profile is generally very good. These are generally very well tolerated. So I would say that opening up from a demand perspective is completely the right decision. Because young people are also involved now. Even in young people, we are seeing oxygen saturation dropping, people getting pneumonia, people landing up in ICUs. I think all of us would have heard of very young people becoming very serious with this disease and also losing their lives. So we have to open it up for all young people. In fact, we might need to even look at vaccination of children, not so far in the future. And I think that is something the world is now looking at very seriously, and so are we, because increasingly we are finding small children are also getting affected. That is something we did not see so much the first time around. So I think from the demand side, it's completely the right decision. Now we just have to boost up our supply to match this demand. I think that is really the crux of the challenge we have right now.
Yes, very true, ma'am. And on a related note, then why do you think that there has been a supply shortage? And if there is one, which I think there definitely there is. How can it be boosted, and how can the supply be met with the current demand for vaccines?
So, again, what was happening was that when we started the vaccination process in January, it was a little slow to take off, because there was a fair bit of hesitancy. We started off in stages. We, of course, prioritized our frontline workers, our health workers first. And I think that was completely right, because those are the people who are at the front lines even today, and trying to battle against this virus and save lives. So I think that was completely right that we prioritized, health workers, frontline workers for vaccination. And then, of course, we prioritized the elderly, because all the evidence we had up till then was that the risk of severe disease and mortality is much more in older people, much more in people above 45, above 50. Now, as I said, that might change in the future. We can't say, because it's not a point in time. Data is constantly changing in this. But based on the evidence we had till then, we picked up the most vulnerable groups for vaccination. But there was a fair amount of hesitancy. So actually, uptake in the initial few weeks was quite slow in many states. It's not true that it was in all states, but in many states the uptake was slow. We were actually seeing vaccine wastage. We were seeing many doses going wasted, and that is something that we have consistently flagged to various states as well, because vaccine is very precious. We cannot afford to waste it. So I think that is something that the vaccination process started off with. Now that we have had this surge, we have also opened up to people above 18 years of age. Now a lot of that hesitancy has reduced. So why the supply is also seeming short is because you suddenly have a lot more demand. Because ultimately it's that demand supply equilibrium, all throughout. And now it's seeming a little short, because you have suddenly a lot of people, who are saying that, look, we want to get vaccinated. We've had crores of people wanting to register and, get vaccinated, which is fantastic from the demand point of view. I think that is completely the way we need to go on the demand side. So now, therefore, the supply is being boosted in a very big way. And there are multiple steps being taken here. And I'll just very quickly outline those. One is that we have boosted the capacity of our own manufacturers here. So Bharat Biotech, Serum Institute, by June, July, you should see that they should be, they should be able to be manufacturing many more doses a month than where they are today. It could be doubling, it could even be tripling. The number of doses that they can actually manufacture a month. So one is their capacity. The other is we have brought in Sputnik. In fact, the Sputnik rollout has just started today. So Sputnik has come in now. Or the United States has also said that they will allocate a certain percentage of the AstraZeneca doses to India. That might not be a very significant number, but nevertheless, it will all add up to our overall number. And then yet further down the line, we have vaccines which we might expect from Aurobindo Pharma as well as Zydus Cadila. So those are also in stages of development, where a few months down the line, even, we could hope that one, if not both of them, gets approved. So I would say that in at this point in time, there's no disputing that there is an issue of supply, especially to match the massive demand that we have now. But within a month or two, I would say that a lot of this bottleneck should clear up, and a lot of the supplies should go up in a big way. So I think it's very important right now that yes, we only go to a vaccination center when we have a confirmed appointment, because you don't want to be having crowding at the vaccination center, and then the last thing you want is that the vaccination center becomes a super spreader. So we have to be careful about this. We should only go when we have a confirmed appointment, and we are sure that the vaccine is going to be available. But I think in a month or two, you will see a significant change in the dosage availability in the country with all these efforts going on. In the background, I think there will be a significant change. Of course, private sector has already started to procure and even provide to people under 45, like in Delhi. The private hospitals, some of the bigger private hospitals are already offering vaccination for people under 45, Apollo and Vedanta and Fortis. So I think you will start seeing that vaccination happening of people under 45. It's not that we won't have any vaccinations happening in May, but I think from June, July, you will see the rate accelerating much, much more. So I think that is what is, right now my hope, that the supply will really go up significantly, just in a few weeks from now, and will be able to cater to this to this massive demand that hopefully we will see. I again and again say that opening up is a very good idea. We do need as many people vaccinated as possible. So I would urge people that even if your vaccination is a little delayed, just have that little bit of patience, just hold on, just register yourself. And as soon as you have a vaccine available, just go and get yourself vaccinated, because that is absolutely critical right now to save lives.
Yes, yes, very true, ma'am. But however, we are also noticing that, as you said, there is a vaccine shortage problem, and 11 states are currently suffering it. So, my question to you is this: How is this a reality that out of the 28 states in our country, only 11 states are facing a shortage and the others aren't? And if this is in fact reality, how is the what exact factor is contributing to this vaccine shortage in only specific states in our country? Is this a logistic error? Is this a manufacturing issue? What is the exact cause of this?
Yeah, it could be a combination, of different factors here. And of course, the demand, the sheer demand. Some states are obviously, population wise, very different from others. We have so much diversity in our country that is the nature of, how we need to operate. So it could just be sheer demand, outstripping the current supply. And as I said, the demand has gone up a lot. When we started in January, a lot of these same states where we were not seeing so much demand. Um, uh, Today we are seeing a lot of demand. So the picture is also changing and evolving based on what is happening on the ground. So I would, rather than say that it's an outright shortage, I would say that it's a question of the supply not being able to keep pace right now with the sudden boosting of demand that we are getting. So I think that is the effort that we are making, and that is the effort the center is making at a national level. Now, of course, the doses to states will be allocated also based on their performance. Also, the vaccine wastage has been included as a criteria when the center will be allocating vaccines to states. They need to make sure that the wastage is minimum. And of course, it will be based on their performance and uptake. So allocation, of course, will be based on all those criteria. But at an overall level, the fact that the center is working to boost supply through both what we have, currently boosting the manufacturing as well as bringing in additional vaccines, that will eventually benefit all states, because the more vaccines we have available in the country, the more manufacturers we have, and the more choice we have, eventually all states will benefit from that. So I'm hopeful that even these states which are currently saying that we have this shortage, or we are not able to keep pace with the demand, in a month or two, if not earlier, this situation should ease considerably. That is sort of my view, and my hope, because I mean, really, we're going after vaccination on a war footing right now. I mean, there's no doubt about that.
All right, yes, certainly. And ma'am, then why are, regarding the vaccination of people under the age of 45, why are the walk-ins not being allowed for that age group for vaccination, particularly?
Yeah, because it is because of the supply issue right now. So as I said, you don't want people to walk in and then find that the supply is not there, and then you have massive crowding at the centers, and then it results in super spreader events. Because we have to be very careful that somebody coming to the vaccination center should not catch the virus. Because that is really terrible. Word of mouth, sort of experience. People will then start sharing that, and then that will lead to more hesitancy. In fact, just in the last few weeks, I've had some people saying, oh, I think I got the virus from the vaccine, and actually they might not have got it from the vaccine, they probably have not, but might have got it from the vaccination center. That is something which is very much possible if they were not following the COVID appropriate behaviors, or if others were not following. So it's very important that we avoid overcrowding, we avoid crowding of any kind at these centers, and that is why walk-ins right now are not being encouraged or scheduled or allowed. But as soon as this supply situation eases, I am pretty confident that a lot of states will then start allowing walk-ins also, because as I said, we want to vaccinate as many people as quickly as possible. I think there's no doubt in that. But we don't want to do it in a way where our supplies are not enough and we have so many people lining up, and then we result in more spread of the infection. So I think right now that is the only reason why you're seeing this. But again, this situation should change. I believe it should change pretty soon as the supply starts ramping up much more.
True, ma'am. And you mentioned in one of your previous answers that even the private hospitals have now started pitching in to a very great extent and providing the vaccine inoculation to the age groups of 18 to 45, and rather to every age group for that matter. So, with regards to that, we have noticed that the pricing of vaccines in private hospitals are actually quite high, going up to 2,400 rupees. So, why do you think, ma'am, that to rephrase it, don't you think that these prices are extremely high in the midst of a pandemic when there is a surge of unemployment and pay cuts for those individuals going to get the vaccine?
Yeah, so a lot of these prices or these hospitals, even that I mentioned, for instance, right now, people who would go there would obviously be people who can afford. And it's people like us, we can afford to pay that. We don't have an issue, paying 1,200 or even 2,000 for those vaccines. But that is limited to people like that. There's no doubt, but that is true for the private sector in general, right? Even for private hospitals, it's only somebody who can afford actually goes there, right? And that is why you need to have those government facilities, those public health facilities for people who cannot afford. So that is why I'm saying that the vaccination is in multiple tracks. The free vaccination for people above 45 at the Government of India centers continues. The supply of vaccines from center to state, 50% free, again, that continues. A lot of states have actually announced that we will make vaccination free of cost in our states. A lot of states have announced already, and I'm hopeful that even more states will come forward and do that. So I think for a lot of people, the people who cannot afford, there should be enough of these other channels, so that they don't have to rely on these sort of big private hospitals, which anyway cater to a very small percentage. I think it's very important, and we would know that an Apollo or a Medanta or a Max, they don't cater to the majority of the country's population, right? They are catering to a very small percentage, but we are not engaging just the Apollos and the Medantas and the Maxes of the world. We're also engaging smaller private centers. So there might be smaller private centers also which are offering it at more affordable prices. In fact, in Delhi itself, there are many smaller private clinics, institutes which are wanting to do this vaccination. So they might come into the mix as well. And of course, there you might see a slightly differential pricing. But my point is that, it is for people, these are places for people who can afford to pay. I think that is, and people who do want to go here, they can afford to pay. This option is there. But there will be plenty of other options and tracks for people who actually cannot afford to pay, because there's no doubt that such options will cater to a very small percentage. And so the other channels, whether it is the central government, the state government channels for the free vaccination as well, will remain open and in fact might go up. As I said, many states have already announced that we will do free vaccination for people under 45, and hopefully that might even increase in the days and weeks to come. Again, as the supply situation becomes more stable, a lot more states might come forward and do the same. So I think it's going to be a mix, but certainly we're not expecting a majority of people to go in here and pay these kind of prices. I think that definitely is not the expectation that the government has.
Certainly. And ma'am, what would you like to say to quell the concerns of those Indians who feel that there is a vaccine storage incapacity?
No, so storage has also been boosted significantly. In fact, when we started working on the vaccination program, it wasn't just the manufacturing, but we've also been boosting the cold storage facilities, the distribution facilities. We brought in technology to try and streamline the whole vaccination process in a big way. And so I think there is definitely, in a country like India, that challenge is there, because our public health system, for years is one where we could have done a lot more to strengthen it, and that is a matter of years of work. I think, again, I just want to make this one generic statement that, strong public health systems are not built in 1 year, few months, 10 months. You can do certain amount of preparation, and of course you can always question in hindsight that could that preparation have been more, could it have been better. I think that is something that is definitely up for a question and debate. But public health systems in general are built over years and decades, of investment. And so yes, it is true that in many parts of the country, um, our facilities, our, whether it's storage, whether it's our basic healthcare, leaves much to be desired. I think nobody can deny that. That is true. But whatever we could be doing, either in the last few months or now, to boost this, just to be able to tackle this current situation, at least we have been working with the center has been working with the states to do that. So I think the concerns are valid. But what one can say is that, all possible efforts are being made at this point. We are also trying to therefore bringing in the private sector in a big way, not just to actually help with the front end, but also to help with some of these back end issues, to streamline them, to help with some of these logistical issues as well. And technology, of course, we're trying to use technology as best as we can. So I think a lot of efforts are being made, but yes, definitely, there are gaps in various parts of the country, and a lot of those are historical gaps as well, which are very difficult to completely address, in a matter of a few months, or a year, or even a few years. A lot of this work is actually work that needs to be done over decades, which hopefully now, after this pandemic, all governments, I'm not blaming any one government or the other, but all governments, be it center, be it state, hopefully all of us will collectively realize that we really need to invest in the public health system, because otherwise, when you have a crisis, it's very difficult to quickly react. That becomes very difficult, because, as I said, crises like these are affecting and crippling some of the best health systems in the world. Even a Sweden struggled so much, when it had an increase in cases. We've seen what's happened in UK, we've seen the US. So my point is that it's such a large country with so much diversity. If you're not consistently investing in your public health system, center, states, private, everybody, then in a crisis, you will inevitably be in a very difficult situation. But right now, the focus is on doing whatever we can at this point in time, so that at least the immediate need can be addressed. And I think that is what the center states, all of us need to put our energies towards. And then, of course, the longer term questions will need to be addressed, but we can do that once, this is behind us.
True, certainly. And ma'am, could you give us some important data in the aspect as to how the PM Cares Fund has been completely utilized? Because there are lots of Indians themselves who feel that there has been an underutilization of the PM Cares Fund, and there is a sense of dubiousness as to in which direction the funds have been used, because they feel that there's a lack of transparency. So, could you just, if you could give us some very important raw data as to which commodities and resources have been procured, that would be really appreciated.
Yeah, so I mean, on PM Cares, again, what has been done with it, how it's been used, or what it was intended for. I think a lot of it has been put out in the public domain, and I think that's what I have access to as well. But I'll just try to summarize, briefly what that is. And I think it was majorly, when it was brought in, it was basic healthcare infrastructure, like ventilators, which, of course, over the course of the last year, we built up much more capacity. When we started the pandemic, we were, struggling with even ventilators and 95 masks, the PPE kits, even the basics. But after that, we have actually ramped up our capacity significantly for all of these. And so I think we are, to that extent, in a better position. But of course, in a surge like this, you still need much more additional capacity. And that is why a lot of countries are rightfully now stepping in to provide that capacity, because we've also helped a lot of countries over the last few months. So it's important that they are coming forward, and they should come forward in a bigger way. So I think ventilators is one big piece of the utilization, and what it was intended for. The other is for the welfare of the migrant workers. Certain component has also been used for that, because, again, lockdowns, etc. We know that It affects the migrant workers, the poor, in the worst possible way. So there's a lot of welfare measures that have been brought for the migrant workers, whether it's the, and this is not just PM Cares, but I'm just still putting it out that the One Nation, One Ration Card scheme, for instance, to, provide food to migrant workers and their families across the country. So various such initiatives, but a certain component of the PM Cares Fund also went directly for the migrant worker welfare and for the welfare of poor people. Now, also, the PM Cares Fund is going to be used. The funds have been in principally sanctioned for setting up medical oxygen generation plants in public facilities, public health facilities across various districts in the country. And as I said, this is with an eye towards the third wave as well. Because it's not the immediate situation, of course, we are importing, we are doing, whatever we can, we are diverting from non-essential oxygen uses, etc. We're diverting everything towards medical oxygen supply. But with an eye to the possible third wave, these plants have also been sanctioned, given in principle approval. So we should also see these medical oxygen generation plants coming up now across, most of the districts in the country. So that is also something that the PM Cares Fund is to be used for. So I think those are some of the key, the broad highlights. Of course, I think it's, it might have been used for some other initiatives as well, welfare initiatives or healthcare related initiatives. But these are some of the major pieces, and also the research and development. The vaccine research and development. There is also a component of that which has gone towards vaccine research and development. So I think that is, and a lot of this information, of course, has been put out, by the government in terms of what it's being used for, and continuously also the government is putting out how much allocation is being made for what from this fund. So that is really the information we have on this. But as I said, it's not just the PM Cares Fund. We're using various other channels of resources, funding at this point, to make sure that we can boost capacity, not just for this wave, but also prepare now much better for the third wave.
Certainly. And ma'am, as you mentioned that there has been a lot of allocation of the funding from the PM Cares Fund towards the procurement and the installation of oxygen plants. So a piece of very important news that was circulated very recently said that the tender for inviting bids for the setting up of 150 oxygen plants was floated in the month of October 2020. Could you tell us why this decision wasn't taken earlier, as in before October 2020, when the pandemic had hit the country right then in March itself, February, March itself? And also, why was this not executed to the complete optimum level? Because as we can clearly see, there is a current oxygen shortage in the nation.
Yeah, so again, I mean, one part here is again the sheer demand supply situation, because the sheer demand for oxygen right now, even if we actually probably had all these plants up and running, we might still have been short, because the demand today is extremely high. When you have 4 lakh plus confirmed cases a day, any health system is going to find it very, very difficult to not run short, and therefore the need to import, the need to get help from other places. So I think that is one side. But that aside, I think the plants, initially the ones which were sanctioned, the procurement, the tendering process was central. So it is not that the states were given those. The procurement, the tendering for that was done by the central agencies. What the states had to do was to identify the hospitals where those could be installed, and to do the ground level work. Now there is definitely different versions. A lot of the states are, of the view that that work did not happen speedily enough, in terms of, the contracts that were given out. But a lot of the contractors, on the other hand, say that some of the hospitals, there was actually a delay at the hospital end, in terms of actually giving us an appropriate site, or helping us set up these plants and get through all the administrative procedures. So the jury is of course still out on that. That is something which will need much more investigation in terms of where exactly the lapses have happened as far as that is concerned. But that is the central, we're talking about the plants which the center was to tender and procure. Simultaneously, nothing has stopped the states from procuring their own plants or from setting up their own plants. So that is important to understand. There is one central channel and there is a state channel. So even if the central channel was not working, nothing was stopping states from actually also setting up these plants to boost their own supply. So I think somewhere, there have been a lack of, I would say, anticipation at the level at which this could go. I think that is where, if there is something that we can be critical of, it could be that in hindsight, you can say that there was a lack of anticipation, or there wasn't enough anticipation that we could land up in this situation. But again, that is sort of tough to say, that how much do you really anticipate, because today we are at 4 lakh cases. I mean, this could be so much more, or this could be a very different picture. So anticipation in a short period of time is a matter of hindsight, is up for debate, whether the fault lies with the central suppliers, or people who were to install the plants, whether the delay was at the end of hospitals. But it is important to say that the state channels were also open. So it wasn't just the center which would be procuring and setting up. Now the plants I'm talking about are going to be sponsored, through the PM Cares Fund. So these will have much more of a central element and angle over there. But historically, the ones we are talking about, a lot of the delays seem to have happened in the administrative, issues, the tendering, the actual setting up, and so sort of between the suppliers, the manufacturers, the actual hospitals, the state governments. So we need to see where exactly those lapses have happened. But that is a matter of looking back in hindsight. But I think it's also a case that even if states were struggling with the central process, they could have still set up their own plants, and nothing was stopping them from that. So I think that is also important to understand. And I think perhaps, unfortunately, a lot of states also, there were some lapses, or they did not anticipate as much. As I say, rather than calling it a lapse, I would rather put it as, not being able to anticipate it to this level. And I think that is something that we can say that might have happened. But now going forward, now that we will have plants in pretty much all the district headquarters, the main hospitals over there, this situation going forward should hopefully not be repeated for us. But again, it's just important to know that it's a demand supply thing. If we keep getting this demand going through the roof for oxygen, we will always keep falling short. So we need to make sure that we curb the pandemic through other routes, bring down this demand for oxygen, make sure that fewer people need it, fewer people need to stay in hospital for that long. So our efforts have to be on the preventive end. We cannot keep looking at the curative end, because how many ventilators will you keep making? How much oxygen will you keep producing? You don't want to keep putting everybody on oxygen and on ventilators. So I would say that the bulk of our efforts have to still focus on the preventive side. But definitely, given that we are in this pandemic, given that oxygen is absolutely life saving, we need to make sure that now we are fully prepared for this third wave. And between the center and the states, if there are any of these issues, operational, administrative, whatever they might be, they are ironed out. But alongside the center, the states must also keep boosting up their own supply in this regard, because they are completely free to do so. There is nothing saying that only the center can give you a plant and you can set it up. States can also do it on their own, and must do it through their own channels as well, in addition to what the center must do.
All right, ma'am. But a follow-up question of mine would be that, as I said, that the tender for setting up 150 oxygen plants was floated in October. So my question is, why wasn't this tender floated way before October? Couldn't this decision have been taken earlier?
Yeah, I mean, I don't know the specifics of this, and so I think it would be tough to answer this one for me, because I was not specifically involved with this particular empowered group which is in charge of making this call. So I think somebody else in the government would be better placed to answer this in terms of the timing, because as far as our empowered group, or what we were doing at Niti Aayog, we have constantly been tracking. Even in the first wave, we were throughout tracking the oxygen requirements of different districts or different states. But a lot of that was based on what we were seeing at that point in time and what we were anticipating. We had actually looked at, because that was the only data we had back in March, April 2020. We had looked at the waves, and the peaks that were happening in Italy, or that were happening in, even the US or Spain or other countries. And based on that, we were preparing for the numbers in India. But that is how we were also preparing for our oxygen supplies, etc. But now the numbers that we are seeing are actually far higher than what we would have anticipated in the early part of last year. So I think part of this could be that we did not anticipate, as I said, such high requirements. But I would not know the definite answer to this. I think that would be better answered by somebody who was in charge of the concerned empowered group, because it was the DPIIT secretary who was in charge of that empowered group, which was looking at the supplies, etc. So I think he might have a better answer to that. But I'm just trying to put out what I think might have happened, is that it's not that preparation was not there, but at this level, and at this level of surge, 4 lakh, excess of 4 lakh cases per day, I think that is the level at which perhaps the anticipation was not there. As well as I think the length of stay in hospital has gone up in this wave. And I think that is maybe another important factor. Because in the last wave, yes, people were needing hospitalization, but it was on average for fewer days. So the oxygen requirement was also less. But in this wave, we are now seeing that people are in hospital for longer. People are on average needing oxygen for a longer period of time. So that is another factor which I think might have made a difference to the amount of anticipation that went into this. But I think that is something that I feel from my end in terms of just looking at the statistics and metrics. But again, as I said, it's we are looking only at the central government side. The state governments, were also completely free to keep increasing their oxygen supply if they thought that they would need it. And I think somewhere, a lot of that also did not happen. So it's really now, I think these are all matters of hindsight, and we can do this sort of post-mortem analysis when we look back, that was the center at fault, were the states at fault, who shares responsibility for what. But I think that this is not the time for that. I think this is the time for us to look ahead, and now make sure that we best handle this situation as well as what's coming ahead for us in the future. So I think that is where we should be looking at this point in time.
Certainly, ma'am. That is a very pertinent point you make, that the focus should be in order to increase capacity and to consider the requirements that are to be ensured and materialized for the future, and not look at the past events that have taken place. However, ma'am, there is a lot of confusion within the minds of the average Indians who are tracking the new developments, especially with regards to the oxygen supply, especially the case that happened in Delhi regarding the dispute between the central governments and the state governments as to who exactly is responsible for the entire process of installation of oxygen plants that were commissioned under PM CARES Fund. So my question to you is this, in order to give a sense of clarity to our viewers, and that is, in whose hands was the complete responsibility of the commission, of not just the commissioning but the complete installation and the operation of oxygen plants and the supply of oxygen plants, and the oxygen empty units, in the hands of who was responsible for this? Was this the ones that were commissioned under the PM CARES Fund? Were these commissioned, or were these installations the responsibility of the center, or were these the responsibility of the state?
Yeah, so I think I have answered that actually already, but I'll just repeat that. That the tendering, etc., was done at the central level, but the actual identification of the hospital sites where they were to be set up, that had to be done by states. Now the reasons for the delay, as I said, are coming from both sides. One is who was awarded the tender. Those agencies saying that The hospitals were not giving us space to set it up, or there were some issues at the level of the hospitals, whereas state government saying that there was a delay on the part of the agency. So I think that frankly right now we don't really know, at least I don't know who is the right one on that or not, and that is something we'll have to look back when we have all the data and we have all the correspondences and everything that's happened. So I think that is something we need to look back to really know where do we apportion the blame, if we can say, for the delay on that. But the process was clear. Process was clear of the center actually tendering, and then it goes to the states, and then the states identify the hospitals, and that's where it gets set up. So I think that element is very clear. But as I again will repeat, that there was no there was nothing stopping states from having their own plants. Even if PM Care completely failed, even if those agencies just did not come, the states could still set up their own plants. And I think that is very important to understand, that channel was still very much open, that was not closed by any stretch of the imagination. So I think that is how we need to look at it. But in terms of where the lapses happened, we would have to look at it in much more detail, because I think the agencies have a point of view, and then the state governments, the hospitals even have a certain point of view. So yeah.
So, ma'am, very well said, very well explained. But if I were to just simplify it in a three-pronged process, so we can say safely, I would like to confirm this with you once, that the process of the installation of oxygen plants starts with the commissioning of the tender from the center. Then the tender is given to a vendor, an oxygen vendor, or the manufacturing agencies, who then take the land clarification and the land clearance from the state governments for the respective hospitals, and then go and set it up in those places. So this is the procedure of the installation of the plants.
Yes, if they are centrally, tendered.
Commissioned.
Yeah, centrally commissioned, but states can commission their own also. I mean,
Okay.
that is also possible.
Okay, all right. So we just wanted to clarify that once, because there is currently a lot of confusion as to on whose shoulders does this burden actually fall, and that's why I felt that we should definitely ask somebody like you, who is a healthcare professional, who is a public policy specialist, who has come on our show, this very pertinent question, which is plaguing a lot of concerns, and it's creating a lot of concerns in the minds of the Indian people. And finally, ma'am, my question to you is this: that testing is regarding testing for the virus. We have noticed, and there are many personal anecdotes about how there are so many instances in which testing has been refused by centers for many of the people who are going there in order to get themselves tested. So, why is this being done? What can be the possible reason as to why people are being refused from getting tested?
Yeah, I mean, I think a lot of the refusal or people not even being able to book tests is again a question of overburdening of the system. There is too much, even private. It's not just it's not government, but even private labs where you're actually paying and you're willing to pay a premium price also. Even for home collections. In Delhi, right? If we are sitting here in the national capital, even right now, a lot of testing is difficult, and that is because the system is overburdened. Whether it is testing, whether it is hospitals, whether it's oxygen, everything is overburdened at this point in time. So I think a lot of it's less to do with a refusal per se, but it's maybe just a fact that the system cannot cope to actually process so many tests. Now, of course, we need to expand testing actually in a big way, especially when we look at places like Delhi, where the testing positivity rate is still in excess of 30%. And that means that almost 1 in 3 people, or more than 1 in 3 people you're testing, is actually positive. Now, that is very high. And what that also means is, which makes it very challenging from a clinical management perspective, is that you're only testing the very serious people. Only people who are very heavily symptomatic are actually getting tested, which is not what we want, because we want to test people earlier. If we test people who are serious, then immediately, we probably need to take them to the hospital, and that burdens the hospital system. So we need to test people who are earlier on in their illness, so that should they have any initial early symptoms, we can actually tackle it effectively in time. So expanding testing is really the need of the hour in many places. In some places we are doing well. Like in fact, even in Mumbai, we have seen that testing and positivity has improved a lot just in the last few weeks. Now in Delhi, we do need to ramp up our testing. There's different ways of doing it. Of course, one is to just expand the different options we have available for the testing. Um, but the other is more and more importantly is the channels for the testing. So whether we have mobile testing vans, for instance, in at least the containment areas or in areas where there's a number of cases which are being identified, or we have large testing centers where we can just get people to come and get tested through a drive-through mechanism, or whatever that might be. So we need to think creatively on testing. I think there's no doubt on that, because we need to expand it in a very big way. And I think we have a lot of these ideas, suggestions which are given, which we also share with the state governments. But also the government is also expanding the laboratories. That work is also on, that at the back end we also need to keep expanding the laboratories, because there's no use doing a sample collection if you don't have the laboratory to be able to process it in time. And that is the bottleneck which is coming right now, that you can collect the sample, but the processing, the signing off of the report, etc., we don't have the personnel also. So I think ultimately everything comes down to the burden on the system. I think that is really the very simple thing to say. The testing, the beds, the oxygenation, if we cannot reduce the demand, the system will remain overburdened. The system will be unable to cope. No matter what we do, no matter what any government does, we will not be able to cope. So we have to reduce these numbers.
Yes, very true. And thank you, ma'am, for explaining that so well for the purpose of clarity for our viewers. And with this, I would like to again thank you very much for joining us on our show and explaining to us so beautifully and so wonderfully the entire process and the entire procedure in which the Indian government is so terrifically handling the COVID crisis. And for this, we are really obliged to you for taking out time from your busy schedule and joining us. It's been a real pleasure having you here on our show.
Thank you. Thank you so much. Thank you.
Namaste. We hope you enjoyed this Citti Media content. Please remember to subscribe to us and switch on the notifications for this channel. For our other social media links, more content, and to support our work, please visit citti.net. Dhanyavad. Namaskar.